All right. Now, we can break the skeleton down into two parts. We're going to break it into the axial skeleton and the appendicular skeleton. Hey, over here. Try to be all fancy and bring my camera now. It's just like, nope, don't care. All right. So we've got the axial skeleton and the appendicular skeleton. The axial skeleton is going to be the portion of the skeleton around the body's main central axis. Okay, so that's to say your skull, your vertebral column, and the thoracic cage. So your rib cage, your sternum, thoracic vertebrae, and all that. Okay, that is it. Okay, your hip bones are actually examples of girdles. Okay, these are your pelvic girdles. So this is what's actually is going to attach your lower limbs to the body trunk. As such, they are part of the appendicular skeleton. Okay, so today we're going to talk about primarily the skull. When we come back next time, we will talk about the vertebrae and some other stuff. But today we're really just going to kind of introduce the skull. So on the screen, you can see in blue is the axial skeleton, and kind of brown or tan, that is your appendicular. Now, associated with every bone, or with many of these bones, are going to be several markings, okay? So this is a bone. In my hand is a bone. This is an example of a bone marking, okay? So if I just said, hey, like, what bone is this? Should be fairly straightforward. But it is also perfectly fair for me to say, what bone marking is this, okay? So we not only need to know the bones, but we need to know some of the parts and pieces of these bones. Now, all of these parts and pieces are going to have a general function associated with that piece, okay? Or a general structure. That's what you're going to see listed up here, okay? We're going to break these general things down into either articulating surfaces, depressions, projections, or openings or spaces, okay? An articulating surface is what it says it is, where two bones are going to articulate. So when this bone is going to articulate with the coxal bone, it's going to do that via this structure here, okay? So this is one of our sites for articulation. We have another couple of sites of articulation down here, because it's a femur, it articulates in three places, really four, okay? Now, we're going to name these based off of this chart. This one is a prominent rounded structure for articulation. So based off of that, what do you think of those four definitions will apply? Is it going to be condyle, which says large, smooth, rounded, oval structure? Kind of, not really. Small, flat, shallow surface? Definitely not that one. What about prominent rounded epiphysis? That one. It's that one. Okay. Why? Because, well, this is the proximal epiphysis of the bone, and it's rounded for articulation. So that means this is the head. In this case, it is the head of the femur. Okay. So we're going to do that a lot, which means this table you need to become very familiar with. Okay. Because we're going to have you identify one or two examples of these, not all of them by any means. We're going to have you identify one or two examples of everything on this list in all likelihood. Okay. Or at the very least, every bone structure that we have you all know will be one of these things on this list. So you can make your life a lot easier when you're going to learn all these bone markings by learning the table first, okay? Or you can try and learn them at the same time, and that's totally fine if that's what you want to do. And just kind of back calculate your own table. That's totally fine if you choose to do it that way, okay? Heads are going to be very important because these are going to be prominent places for us to connect bones to bones. Condyles are also going to be very important. These are going to be large, smooth, rounded, oval surfaces. This down here is an example of a condyle. In this case, it is the lateral condyle on the femur. Lateral because it's lateral to this, okay? So this is the lateral condyle of the femur. This is what's going to interact with part of your tibia. So the medial condyle, okay? We're going to have a few examples, like I said, of each of these. Another big one is going to be a fossa. So fossae are going to be kind of shallow depressions. Anytime we have a shallow depression, we're going to call that a fossa. A big one for projections, at least for today, is going to be process. So a process is a bony protuberance, okay? So a bony protuberance, like say this one back here on our vertebrae. Well, this is a bony protuberance, so we're going to call this a process. This is a bony protuberance. This is a process. Right beside that is another bony protuberance, also a process. Okay, so we're going to see process come up a lot. So whenever we say the word process, it just means like we have a pointy bit of bone. Okay, we're also going to see lots and lots of openings or lots and lots of holes. The term that we're going to use most often for a hole that we see is going to be foramen. Okay, so foramen is going to be a hole. Now, when we look at the skull is composed of 22 bones. Okay, it sounds like a lot. Okay, it's really not, but 22 bones right here. Okay. Now, we're going to further break down the skull and those 22 bones into two main functional groups. We have the cranial bones and we have the facial bones. The cranial bones are going to be the bones that are going to form what we call the cranial vault. Okay. So basically are going to envelop, surround, and protect the brain. So if it is around the brain, it is going to be a cranial bone. Okay. Now, if we turn it this way and we look at these sets of bones, these bones are not necessarily dealing with the brain. However, they are forming the framework of our face. Okay, because these bones are forming the framework of the face, that means they're also going to have all of the openings for things like air, food, special senses, air through the nose, openings for the eyes. These are all facial bones. So we have cranial bones forming the cranial vault, and then we have facial bones, which are going to contain the openings for our special senses and things. Now, our skull is also going to have some cavities. Not only do we have the cavity for the brain, where we can see these little shallow depressions or fossae in the brain case, we also have to have some cavities for, hey, sit, there we go. We also have to have some cavities, of course, in our mouth. We have our oral cavity, we have our nasal cavity, and we have our orbital cavity, so the cavities for our eyes. But in addition to those, we have some sinuses. A sinus is going to be an open spot inside of a bone. It's not going to be spaces in between bones. It is going to be spaces or openings inside the body of the bone itself. Now, these paranasal sinuses do a few things for us. One is they're going to allow us to lighten the weight of the skull a little bit because it's not super dense. We have these openings which are going to at least allow us to shave a little bit of weight off. But these are also going to give our voice a lot of resonance, okay? The air that we are blowing out while we're talking gets into our head and rattles around a little bit, okay? And as it rattles around, it gives our voice some kind of resonant tone. Now, the bigger head you have, the more those tones will resonate. So you will tend to find people that have bigger heads will have deeper voices because the sound can resonate more around their head. Okay. Now, part of the other reason that their voice is going to be a little deeper is because their trachea is also going to be a little bit more open, and that's going to allow for slower vibrations of the stuff. Okay. So it's not just the head that that messes with that stuff, but it is one of the factors in kind of the resonant tone of their voices. However, that also tells us why we tend to sound a little nasally when you stop the air able to move through those chambers. When you close off the ability of the air to pass into or through those sinuses, you also change its ability for those tones to resonate and your voice changes its tone. Okay. Now, these sinuses are also all going to be interconnected to your nasal sinus here. And if they get infected and you stop the ability of air to get into or through them, that's why you tend to sound a little nasally, but also that's why those tend to start to hurt like hell, because these are filled with soft tissue. That soft tissue gets inflamed and it has nowhere to go. When that soft tissue gets inflamed and it has nowhere to go, it is going to send a signal that says, hey, this hurts. Okay. So that's why people will get sinus headaches and stuff like that, is because you get a blockage in one of those paranasal sinuses and that fluid can't go anywhere and that tissue doesn't like it and it will send that pain signal. Nasal headaches are no fun. All right, so let's start to look at the bones. Now, we are looking at a superior view, so we're looking at it from above. And in this case, you are looking at it where we have posterior here, anterior up here. This is your frontal bone. Okay. So this is, of course, going to form the front of your face, your forehead, things like that. It's also in the frontal region, convenient, almost like it's that way on purpose. Then behind that, we have our parietal bones. Okay. Now, in addition to knowing the bones of the skull, the bones of the cranial vault, I actually also want you to know the name of the sutures, that's to say the connection points between these bones. Now, this one between the frontal bones and our parietal bones off on the sides, we're going to form this kind of crown shape right here, and we're going to divide the skull into a front and back. Does anyone remember what the name of the plane was that separated something into front and back? The coronal plane. Convenient, because this, following through that plane, is the coronal suture. All right, someone else want to take a guess what the suture is going to be that divides your skull into left and right halves? Based off of the name of that plane? Close enough. Sagittal, exactly. So this is going to be our sagittal suture here, which is separating our two parietal bones. Okay. Now, as we move more posterior, we get to this bone here. This is our occipital bone. Now, the occipital bone is going to form the back and, importantly, the bottom of your skull. Okay. So the back and bottom is going to be the occipital bone. The side is going to be our temporal bone. Now, one fun thing happens with the suture on the occipital bone, and namely, that is that we can see these large ossification centers. We have fused together to form these large, what we call sutural bones as part of our lambdoid suture for our occipital bone. So that's to say that we had several ossification centers, and those ossification centers expanded and expanded and expanded and got pretty big before they were able to fuse together the parietal bones and occipital bones during growth. Okay, so we call those sutural bones, but they are part of kind of your occipital bone, or at least part of the suture that we're going to call the lambdoid suture. And notice I'm saying lamb, like the animal, doid. It's L-A-M-B, which is how we spell the animal, doid, D-O-I-D. Okay, do not forget the first D in lambdoid. Otherwise, you will lose some points because I do count off for spelling. Okay, all right. All right, now when we look at it from the front, we get a lot more bones, like a lot more bones. You'll also notice there's a lot more structures labeled. Now, because I am not a demon, I'm not going to have you know the name of every single structure that your book labels on the skull, okay? Thought about it, would be fun, but I'm not, okay? So keep that in mind whenever you're doing your reviews later on in the semester. That it could be way, 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 way worse than it actually is. I've actually shortened our structured list for this chapter by something like 30%. Okay, so keep in mind it was another third larger when I got here. You're welcome. Anyway, when we see the front, we can, of course, see all the openings for our special senses and things like that. Lots of different bone markings from up here, but we can also see the rest of the bones. Now, looking at it from here, we, of course, have our frontal bone. Then underneath that, we've got our nasal bone. And then we get to the top jaw. This is our maxilla. The bottom jaw is our mandible. Moving back around, so moving kind of to our eye orbit here, we can see our temporal bone. Then we have our zygomatic bone here. This is your cheek, okay? Now, forming the back part of our eye orbit is actually going to be our sphenoid bone. The sphenoid bone is, in my opinion, the coolest bone of the skull because we're going to be able to see it from every single direction, including this anterior view, okay? Now, anterior to that, you're going to see the ethmoid. You can't really see it from this angle, but it's actually going to be what's white right here, kind of in this skull. And then you're going to get up to the lacrimal bone, which is right here. You can feel your lacrimal bone when you kind of pinch your nose or kind of pinch on the inside of your eye. You'll feel like a little bump or a little groove just posterior to kind of the bridge of your nose. When you feel that little groove, that is actually feeling the lacrimal duct. So you're feeling that little groove for the lacrimal duct in the lacrimal bone. So that's your lacrimal bone right there. Lacry means tear. So that's actually where your tears are going to drain. It's that little groove that you're feeling. All right. We've also got the vomer right here, which is part of the bones that are going to be separating our nasal cavity into its left and right regions. We can also see some nasal conchae and stuff in here, but we're not too worried about those at the moment. Looking at it from the side, we can also see our temporal bone. We also see this big bridge, this bony protrusion going away from our temporal bone and towards the zygomatic bone. Well, the word for that was what? You want to remember? For a bony protrusion? Starts with a P. Process, very good. It's a process, okay? So this process is pointing towards the zygomatic bone, so we're going to call this the zygomatic process. We've got two more processes on our temporal bone back here. We have this one, which is our styloid process. Like the way to remember this one is that it looks like a stylus pen. It's like if you're signing something at a cash register, you're using a stylus. Okay, so if it looks like the end of a pen, it is the styloid process. This one's going to be very important attachment site for muscles for swallowing and speech and stuff like that, for your tongue. Then we've got this one right here. This is a different process. This is the mastoid process. The mastoid process, you'll notice, is a lot larger. Why is it a lot larger? Do you think these muscles that are attaching here are stronger or weaker than the muscles that are attaching here? Stronger. The muscles that allow you to move your head and neck attach here. They attach to this mastoid process, okay? So thus, it has to be fairly strong to be able to deal with that. You can actually feel this behind your ear. So if you find your ear and find the big bump kind of posterior and inferior to your ear, that is your mastoid process. You can also feel that to try and palpate it, you're noticing that there's a bunch of muscle right there around it. You can actually follow those muscles down to right here down on your neck. Okay. Now we can also see one other structure here, part of our mandible. From the front, you can see these holes as well. This is a hole. Remember that the word for hole is foramen. This is a hole in the mental region, because remember the mental region is on our chin, right? So we have a hole in our mental region, so we're going to call that the mental foramen. You can also see your ear hole right here. Your external acoustic meatus. Now, when we flip it over and we do an inferior view of the skull, we can now see some fun bits and bobs down here too. So we once again form the base of the skull using our occipital bone, and we have a large hole running through. Anyone want to guess what's going to be found right here? What's going to run through this? Your spinal cord. Exactly. Your spinal cord is going to go through here. Inferior to the foramen magnum, it's your spinal cord. Above the foramen magnum, we call it the brainstem. Okay, that's basically your demarcation line. That is the door. Okay, it's going to be right here at the foramen magnum. Foramen is a hole. Magnum just means big. So we have a big hole. Okay, on either side of the foramen magnum, just anterior to it, you're going to see these rounded sites for articulation. So they're round and they are smooth. They're kind of shaped like the bottom of a rocking chair. Those are what we're going to call occipital condyles. This is where we are going to articulate the skull with the spine. It is right there on those occipital condyles. Thus, these are a fairly important structure, I would argue, considering it is literally holding the weight of your world on those two things. Your head weighs something like 10 pounds when it's got the bone and all the squishy bits and stuff inside it. You don't believe me that it's heavy? Go ask your anesthesiologist. Okay? Their arms will actually be strong. Like whichever arm they do all of the lifting of the heads with as they're trying to intubate people, that arm will be significantly stronger than the other one because they're constantly having to lift up people's heavy ass heads. Literally not a joke. My wife is one, so. And it is noticeable. And she actually does it with her left hand, even though she's right-handed. It's so that she has more control over the glide scope that she's using her right hand with. So her left arm is actually stronger than her right, just because of her intubating patients with her, like lifting their heads with her left hand. Not a joke. Also, we can see lots of lots of passageways for things like nerves and blood vessels. The two that we're going to have you know for these, we're going to have you know the jugular foramen and the carotid coronal. Now, the way I recommend learning all of these bone markings is not to try and learn them right now or to try and learn them all at the same time. What I would do is first learn the names of the bones. Learn the names of the bones first, and then as you are learning each bone or looking at each bone, then you can kind of subdivide each bone and learn the bone markings that you can find in each bone. For instance, I pointed out several for the occipital bone. The jugular foramen is a hole in the occipital bone. So it's this little hole right here, kind of at this border between the occipital bone and the temporal bone. The carotid canal would be really easy to confuse with it, except for the fact that it's in a different bone. So if I learn my carotid canal as part of my temporal bone structures, like along with my zygomatic process, my styloid process, my mastoid process, and I loop my carotid canal in with those, it's going to make it a lot easier for me to recognize, like, oh, wait, this is a structure in the temporal bone, which means you're less likely to confuse it with the jugular foramen, even though they're close together, just because, like, oh, wait, no, this is in a different bone. And then you'll pull out the structure that goes with that bone. Does that make sense? Learn your bones. Once you know your bones, then learn the markings of each bone. Okay, so for temporal bone, that's, like I said, your zygomatic process, your external acoustic meatus, your carotid canal, and so on and so on and so on. Now, when we look at it from the inside, the skull also looks super cool. Here's our sphenoid again. Oh, wait, I didn't show you this one. Right here, purple, sphenoid bone. From the outside, sphenoid bone. Oh, wait, hold on. From the inside, sphenoid bone. We can see the sphenoid bone from literally every direction. This is the keystone of your skull. It is going to form the center mass of your skull. Okay. It's also super, super fun looking. Notice that it kind of looks like a bat or a butterfly here. I think it looks more like a bat, but that's probably just because I played World of Warcraft and it reminds me of like the flying bats in that game. Also, it has a saddle, just like the flying bats in that game. In this case, that saddle is there to hold or protect and support your pituitary gland. So your pituitary gland is going to be the secretion site for a lot of hormones, particularly control hormones that tell your other hormone structures how much of their hormones to produce. That's going to be found in your pituitary gland. And our bat right here, our sphenoid bat, has a saddle on it specifically for our pituitary gland. We're going to call that saddle the sella turcica. Okay. Now, we also have our ethmoid bone right here. So that was a little bone right here, just kind of makes up the medial portion of our eye orbit. We can see it from above as this little groove or like a little peak. And then on either side of that, you're going to see a whole bunch of holes. It's hard to see in this picture, but when you actually look at a model, you'll be able to see the protrusion, which we're going to call the crista galli. And then we're going to have some little holes on either side that we're going to call olfactory foramina. Foramina is just a plural for hole. So these are going to be some small holes that our olfactory nerves are going to pass through. This picture is basically just here so you can see the awesome three-dimensional shapes of some of these interior skull structures. So our ethmoid bone, our sphenoid bone, our vomer, things like that. It's super fun. There is actually a version of these skull models that they call a Beauchene skull, where basically they take all of the bones and disarticulate them a little bit, and they put like a 1/2 inch or 3/4 of an inch of space in between each bone, so you can see their shapes. But that means they have to have a mold of the sphenoid and ethmoid and try and get connected in there. So this model costs $200 or $300. The Beauchene skulls cost $2 or $3 grand because they are that much more complicated. They're super sweet though. I'll show you a picture of one. They're super awesome, but they are very expensive, which is lame. All right, here we have our paranasal sinuses. So I'm going to leave it here for today. So what I want you all to do then basically is look over these things as much as you want. But the first goal of business is going to be to identify the bones of the skull. Identify all the bones. Once you've got the bones identified, then you can work on naming some of the accessory structures or like the bone markings. Bones, then bone markings. Learn 3, 4, 5 bones at a time, then work on another 3, 4, 5 bones, and work on another 3, 4, 5 bones, and then start adding in your bone markings. Once again, I have you know a whole lot fewer bone markings than there are in the book. So make sure you are looking in or at the outline to figure out what bone markings you need to know. Everybody good? All right, let's get going. And also, don't feel like you're